But it is true, as long as there's no vaccine, we are going to remain vulnerable to the coronavirus. Now, research into a vaccine is occurring here, it's in Asia, they're looking at it in America, Europe. We may get lucky, might get a vaccine next year, or more likely, have to wait a few more years. But there's also research being done right here in Australia into a drug that could stop you getting this COVID-19 for as long as you take that drug. So it's not quite a vaccine, but it is protection. And this drug, hydroxychloroquine, is already used to treat lupus and arthritis and malaria, so we already know it's safe in the prescribed doses. In Victoria, the Walter and Eliza Hall Institute has started to trial this on hundreds of doctors and nurses. Now, in March, I talked to the boss of that institute, Professor Doug Hilton, and although it's still very early days in getting this trial up and running, I thought it was worth finding out from Professor Hilton how it's all going so far. Professor Doug Hilton, thank you so much for your time. Where are you up to with this trial?
Thanks, Andrew. Look, we're going really well. The first hurdle was to get the ethics approval from the hospitals across southeastern Australia for participation in the trial, and recruitment for the trial starts in the next few days. So we're super excited. It's a really fabulous time.
Right, so it's too soon to know whether it's going to work, obviously, but can I just ask you, hydroxychloroquine has become perhaps the most politicised drug in the world because President Donald Trump, of course, promoted early on, and then the media hit back a few weeks ago saying the drug, there was a study that had shown no benefit when used as a treatment of COVID-19 patients at US Veterans Hospital. Now, obviously, that's different. That's trying to treat patients, and a number of them quite late in the course of the disease. You're trying to treat it as a preventative. Are you still confident, though, in hydroxychloroquine?
We're confident that it's a hypothesis worth testing. And as you say, Andrew, it's much, much harder to stop the disease, stop viral diseases when they're rampant in the body. And we've had that experience, whether it's influenza or HIV or a whole lot of different viral diseases. So we think the idea of using hydroxychloroquine as a prophylactic, a preventative strategy in healthcare workers has a much greater chance of succeeding, and that's why we proposed the trial rather than an intervention trial once patients are desperately ill.
And looking around the world, because hydroxychloroquine has been the sort of the drug of choice of many studies in the several continents, have you seen anything bar this one smaller study in America in the veterans hospitals that gives you reason to doubt that it might work?
Look, the trials on using it as a treatment have been mixed, often with very small patient numbers, and really it's apples and oranges. Trying to decide whether or predict whether the prophylactic trial is going to work based on treatment trials is a really tough job. So we're still really committed to the trial, and we think it has a great chance of success. But you have to see the data. As scientists, it's not enough just to hope the idea is good and going to work and roll it out. We have to do things in a really well-managed, ethical way and provide evidence for the use of this drug or not.
Now, of course, that's absolutely correct. When I talked to you last time, that was probably right at the very peak of the infections. Now I've seen that rapid fall, and there are very few active cases out in the community. It makes me wonder how you can run a trial of this drug as a preventative. You're going to give it to the plan is 2,200 people, medical staff. How can you do that when there are so few infectious people around to pass on this virus to them? How can you test it?
That's a fantastic question, and it's one that we've looked at and we've thought really carefully about. But what we've seen, for example, with the meatworks in Victoria is even though we're in this really successful suppression phase of the COVID pandemic in Australia, fabulously successful, we know there are going to be these outbreaks. So despite social distancing, despite hand hygiene, despite all of the measures that we put in place, we know that there are going to be these outbreaks, and we know our healthcare workers are going to be exposed. So we think that over the next months, as we deal with the pandemic in this suppression phase, there are still going to be plenty of opportunities for testing the validity of using hydroxychloroquine as a preventative. So It'll take a little longer, I'm sure, but I think we'd all prefer to be in the position where healthcare workers are being exposed less often than the terrible situations that we saw in northern Italy or New York when healthcare workers on the front line are dying every day from the disease.
Professor Doug Hilton, that's a problem I think on the one hand you'd actually be glad to have here, I'm sure. Thank you so much indeed for your time and good luck with the trial.
Thanks for your interest, Andrew.